I'm Dr Ian Strawford and I'm the Medical Director of Skin Excellence Clinics. Have you ever heard about Ellansé? Well, this is the fantastic collagen stimulating dermal filler, long-lasting dermal filler. I'm going to talk to you more about how we can use Ellansé, how we can harness the power of your body's regeneration. So making Ellansé a pretty unique dermal filler in my clinic, and one that most of my patients are requesting. So stay tuned and I'll answer all your questions about Ellansé.
What is Ellansé and how does it work?
Ellansé is an injectable dermal filler, but it's a very unique dermal filler in that it stimulates the natural production of collagen where it's injected in the body. Ellansé itself consists of two things. One is something called polycaprolactam. Now this is the microspheres that are within the Ellansé product that stimulate natural collagen. And there we inject them in a gel called CMC, or carboxymethylcellulose. So it's injected very much as if it's a filler going in, but the CMC gel is very temporary and lasts for maybe 2 or 3 months, whilst allowing the little microspheres or little cell-sized particles of polycaprolactam, which is an inert material, to stimulate collagen. And those little particles can stay a long period of time, either 18 months or 2 years, depending on which of the type of Ellansé that we're using. So we're getting a sustained collagen stimulation within the tissues. So we see a natural volume replacement. We see a natural regeneration of the skin, producing healthier skin, more elastic skin. So a reversing of skin aging at the same time as producing volume beneath the skin to compensate for the volume loss that is happening in our face as part of the aging process.
What sort of patient is suitable for Ellansé?
The type of patients who are suitable for Ellansé is any patient where we may be addressing volume loss in the face. Now this could be in the temples, in the mid-face, along the jawline. Now that volume loss occurs in the aging process for lots of factors. It could be due to bone loss in the area, especially the temples and around the eyes. It could be the loss of the fat, the deep fat within the tissues, and it could be related to the superficial fat beneath the skin. So we can place our Ellansé in any of those areas where we're wanting to get volume replacement. But also we know that laxity of the facial tissues happens with the aging process, so that's where everything's coming down, creating the jowls and the nasolabial folds. And that's not just due to volume loss, but is also due to the loss of ligamentous attachments of the skin to the deeper tissues. And if Ellansé is used because it will stimulate collagen beneath the skin, it can help reverse some of that changing and address some of the laxity as well that we see. And when we use Ellansé beneath the skin, very superficial, we're actually creating a regenerative or biostimulation to improve the quality of the skin. So we may see that as less lines and wrinkles, skin that has better hydration, better elasticity, a better glow. So Ellansé is a pretty unique product in that it can address all of those areas of facial aging and within the same range, and it will give a long-lasting, sustainable result. So once we've built that collagen, the skin has changed, we're often seeing the results of Ellansé being stable and lasting several years. 2 to 3 years is not uncommon. And so it's a very, very natural, regenerative product that is very, very popular in our clinics.
Is the treatment painful?
So a lot of patients worry when they come and have an injectable treatment, such as Ellansé or dermal fillers, is it going to be painful? The procedure is very comfortable. I use small amounts of anesthetic called lidocaine that is injected into the skin, and in some areas we may even inject it deeper to block the nerves. So most patients find that the treatment with Ellansé is very comfortable and not at all traumatic.
Is it safe, and what are the risks of the treatment?
Safety is always paramount when we're doing injectable treatments such as dermal fillers or collagen stimulating fillers like Ellansé. And the safety is two elements. Firstly, the actual injections themselves. So we have to have a very good understanding of the facial anatomy, and especially where the facial arteries or blood vessels may be, because most of the serious complications with fillers are due to people placing that filler in those blood vessels or blocking those blood vessels and creating something called a vascular accident or vascular necrosis of the skin, or even blindness. So in our clinics, we use predominantly cannulas, blunt tip cannulas, to make that procedure incredibly safe. I have a very deep understanding of the facial anatomy, and we're even starting to do ultrasound scanning of the face before treatment to understand where those facial arteries and dangerous blood vessels are yourself. So our skill and technique is as safe as it can be. Within the treatment itself, then, with any filler, with any collagen stimulator, we need to be injecting people who are healthy, because we need a good, appropriate immune response to that treatment. And problems like lumps and bumps and inflammation, prolonged swelling, are often related to an immune system problem or an infection. And so we will properly screen all of our patients from a medical perspective to make sure it's safe to inject those products. And if we do suffer, which thankfully is incredibly rare, complications from any filler treatment, whether it's a hyaluronic acid or Ellansé, then we have the skills and the knowledge to be able to manage those complications. So another reason why it's important to seek treatment only in appropriate medical clinics and specialities.
Can Ellansé be combined with other treatments?
We're often, when we're dealing with the aging process, developing a treatment plan for our patients, depending on the stage of life that they're at and the aging that has happened and the damage to their skin, perhaps from the sun. And we're often combining treatments such as Ellansé with other modalities, such as botulinum toxin or Botox, or laser resurfacing, or regenerative treatments such as polynucleotides or Tixul or Morpheus 8, these treatments to try and tighten the skin and rejuvenate the skin. But where we're looking for volume and support of the tissues at a deeper level, then Ellansé is definitely the go-to product in our clinic.
Why come to Skin Excellence clinics for Ellansé?
When you're coming to Skin Excellence clinics, and certainly seeing myself, you're seeing a team who have a wealth of experience in dealing with our patients. We have a deep understanding of the aging process through many, many years of study and anatomy especially. And I'm renowned. I've been using Ellansé for over a decade, and I'm often seen as an international expert, lecturing and teaching other doctors in the use of Ellansé, especially when we're able to use Ellansé for what we call a full face rejuvenation. We're actually treating the whole face, so we're getting very natural results that look normal, not developing aliens out there with over-volumized faces, which we see commonly now. So I'm producing natural results. It's a better version of yourself, and all of that is discussed at an in-depth initial consultation when we look at your personal aging and conditions and work out a treatment plan, which often will include Ellansé as part of that treatment plan.
What is the difference between hyaluronic acid fillers that are commonly used compared to Ellansé?
So at Skin Excellence clinics, I use both simple, what we term as hyaluronic acid fillers, and Ellansé. So the primary difference is that Ellansé is a long-acting collagen-stimulating filler. So following the initial treatment, the outcome may look very, very similar in that we may be restoring volume and lifting the tissues using either the hyaluronic acid or the Ellansé. But what we see with Ellansé that makes it different to a hyaluronic acid is that it will then start to stimulate natural collagen production beneath the skin to replicate that volume and to also improve the skin itself. So we're getting a biostimulation of the skin, we're getting a natural volume, and the Ellansé, the polycaprolactone, stays within the tissues for a long period of time, almost like a slow release collagen stimulation. So the results from Ellansé can be significantly longer lasting than we would see with the hyaluronic acid. And that's probably the main difference.